my name is Alex Rendon. I'm one of the graduate students at the University of Texas at El Paso. Today I am here with Becca Strita. She's my fellow classmate, and we will be teaching you guys how to do a cardiovascular assessment, okay? My teaching objective for the cardiovascular assessment is I want students to be able to do a focused history on cardiovascular issues a patient has had. In addition, I want them to complete a complete cardiovascular assessment on their own. I want them to identify any heart sounds, the S1, S2, any murmurs, and S3 and S4. So first of all, before completing any assessment, of course, as a nurse, we must introduce ourselves and we must ask the patient for permission to assess, okay? Hello, Ms. Castrita. My name is Alex. I'm going to be your nurse for today. Okay. Is it okay if I do an assessment and ask you some questions about your heart and any issues you might have had in the past?
Yes, of course.
Okay, sounds good. We should also ask if they have any pain. Any pain can affect their heart rate, their pulse. Ms. Castrita, do you have any pain at the moment?
No, not right now.
Okay, very good. Okay, after we have asked, we're going to go ahead and wash our hands. We also have to make sure that the environment is quiet. We do not want to make other sounds interfere with the heart sounds, okay? Okay, so the assessment's going to begin with inspection, and then it's going to be followed with palpation, and then auscultation. Upon the assessment, for privacy purposes, we prefer for the patient to be exposed in their chest area. I'm going to ask Ms. Castrita to hold this sheet for me. And this is just a sheet showing the chest. As far as inspection, the best way to see the apical pulse is if the patient is sitting the way she is right now. The reason being is because the heart is closer to the anterior wall. Unfortunately, and not all adults will be able to see the apical pulse due to muscularity. Also, with females, they do have breasts, and also due to people that are obese. Okay. So usually, you should be able to see an apical pulse. It should not be bounding too high up. If it is, then it might give you a sign that there's some cardiovascular issues going on. Okay. Thank you so much. Okay. Now, Ms. Castrita, you can go ahead and lay down for me. Okay. At this moment, you're going to notice if she's having any shortness of breath, any difficulty breathing. Do you feel any shortness of breath right now, Ms. Castrita?
No, I do not.
Okay, very good. I'm just going to go ahead and pull the pillow. If you can just relax for me. Okay. Okay. Now, what we're going to do is we're going to assess the vein distension, the jugular vein distension. The way we can do this is we're going to ask her to turn her head to the left. Thank you very much. Now, we must remember that it is the internal jugular vein which is connected to the aorta and not the external jugular vein. So all we are going to be looking at is that we do not see any distension on the jugular vein, which we don't. So very good. You may go ahead and relax. Now we're going to go ahead and start with the skin assessment. We are going to be looking for pink skin. That's the normal skin color. Other abnormalities would be pale skin, flushed skin, mottled skin. Mottled skin, what it is, it's just irregular skin colors they're found in patches, okay? Cyanosis, we will be looking at the fingernails, and they can also be found in the mucous membrane, so on the lips. Right now everything looks pink to me, so we are good. Okay, now we're going to go ahead and start with the lower extremities. We're going to assess for any edema. Edema can be found, it can be generalized, it can be dependent to the lower extremities, or it can be pitting edema. Pitting edema, what it is if we use our finger and we see some swelling and we press down and there's an indentation left, that would be considered pitting edema. We can score pitting edema using a score being 0 to 4, 4 being about 8 millimeters deep, okay? And I have a visual actually that can help you guys. So this one right here just shows +1 edema. Pitting edema is 2 millimeters. +2 edema is 4 millimeters, +3 is 6 millimeters, and +4 is 8 millimeters. So after assessing any edema, which Ms. Castrita does not have, we will be doing the capillary refill reflex. The capillary refill test, what it does is we're checking that there is normal blood flow through the lower extremities. So what we will do is we're going to press lightly on the finger. We will release. We're going to count the seconds it takes for the pink color to return to the nail bed. Normal capillary refill time is less than 3 seconds. Anything above 3 seconds, that would be considered abnormal, okay? Okay, so we have now completed the whole inspection assessment. Now we're going to go ahead and start with the palpation. With the palpation, what we're going to do, we're also going to expose the chest. We're going to find the apical pulse. That's normally found in it's mid-clavicular, fifth intercostal space, okay? So what I'm going to do, I'm going to use the 4 fingers of my hand. I'm going to place them slightly on top and the palm in the sternum, and I'm going to try to feel for the apical pulse. So the apical pulse should not be greater than the size of a penny. If we do find that the apical pulse is larger than that, then we might show that there is an enlargement of the left ventricular. Okay. After that, we're going to go ahead and start with the palpations of the pulses. There's multiple places where we can actually palpate the pulse. There's the brachial, the apical, the radial, the femoral, the popliteal, and the dorsalis pedis. Okay. We're going to go ahead. I'm going to go assess her radial pulses. With my dominant hand, I will place it on her radial. There's a clock right in front of me, so we're going to try it in here for at least a minimum of 30 seconds. What we're going to be checking for is the rhythm, the depth, and the rate. The normal rate for a radial pulse is between 60 to 100 beats, okay? We also want to make sure that the rate are symmetrical with both hands, so I'm going to use both hands to assess that the rhythm and rate are the same on both hands. Which they are. And the depth, it's good. We want about a +3, +4 bounding pulse, okay? We can also go ahead and assess the beat for the pulse. We also want to check it for a minimum of 30 seconds. And she has good bounding pulses, +3, +4, they are symmetrical, okay? Very good, Miss Leslie. Now we're going to go ahead and start with the auscultation, okay? We will be using the bell of your stethoscope. Once again, I'm just going to ask Ms. Castrita to place this over her. I'm going to say you, okay? That's fine. Prior from the auscultation, you just want to make sure that they're not experiencing any discomfort, that they are comfortable, like I said. Any pain or discomfort can change the rhythm, the rate of the heartbeat, okay? Are you feeling okay, Ms. Castrita?
I'm feeling okay.
You don't have any pain?
No.
Okay, very good. Okay. So first of all, the way we should be starting is we're going to start the aortic valve, which is the second and third right inner space, and then we'll be moving to the pulmonic valve, which is the second and third left inner space, okay? There's a second pulmonic valve, which is right below it. We can assess that as well. And then the tricuspid valve, which is the left sternal border. And then finally the mitral valve, which is the apex, okay? Once again, we will be auscultating for at least 30 seconds, where we will be checking for the rate, the depth, okay? For symmetry, what we can do to see if there's any regular heart rates, we can go ahead and when we're auscultating, we can also compare with the radial pulse, and they should be even, okay? Okay, Ms. Castrita, so I'm going to start auscultating, and you can just relax and breathe normal.
Okay.
Now I'm going to go ahead and compare the apical pulse with the radial pulse, just to make sure that they are symmetrical and that I do not hear any irregularities, okay? Okay, they are symmetrical. Just remember that the heart sound, what you can remember, it should sound like a lub-dub sound, okay? If you're having difficulties identifying the S1 sound, what we can do is when you're auscultating the apical pulse, you can also place your hand upon the carotid pulse. And when you feel the bounding pulse on the carotid, that would be the S1 of the heart. Okay, very good. Of course, there's additional heart sounds that you might hear, such as murmurs, the S3 and S4. I have provided a YouTube video where we can go more into detail so we can identify the different heart sounds, okay? After completing the assessment, I'm just going to ask you a few questions if that's okay with you, Ms.
Okay,
Castillo.
that's fine.
Okay, have you ever had any chest pain in your past?
No, just when I exercise.
Just exercise.
Mhm.
What kind of pain do you feel?
More like a pressure than anything else.
And does it radiate anywhere?
No, just stays in the chest.
You don't have to take any medications to relieve it, or
no.
how does it usually
No,
relieve?
once I stop exercising, it usually goes away on its own.
Okay. Any heart defects as you were born? Any family history with hypertension?
No, my mom is the only one that has high blood pressure.
Okay. Do you feel any shortness of breath when you're ambulating?
No.
Okay. Any swelling to your lower extremity?
No.
Any shortness of breath?
No.
Do you smoke?
No,
Okay,
do not.
very good. Do you have any history of high cholesterol?
Not that I'm aware of.
Okay. And how do you exercise daily?
Yes, at least 3 times a week.
Okay, very good. Okay. After we have completed a basic cardiovascular history assessment, we asked Ms. Castrita if she has any additional questions regarding her care. Ms. Castrita, do you have any questions regarding your care?
No, not right now. I think
Okay.
I'm okay.
Just make sure after we have completed the assessment that you document everything you have found and always notify your physician of any abnormalities.